I'm Dr. Jagannath Dixit. I'm a senior consultant working in Aster International Institute of Oncology. I'm going to, share my thoughts on the robotic surgery in gastrointestinal cancer. The gastrointestinal system is a very huge, starting from the mouth, esophagus, stomach, small intestine, colorectal, and other organ. So in this vast hollow viscous area, I think the robot has got a huge play to do. And this robotic surgery, the advantages are that it has got a 3D vision and it has got a beautiful magnification of 10 times. So the machine is designed in a such a way that it is a intuitive movements. When you move a little and the inside the movement will be very limited. So, and these are all called the ergonomics. In the hand we have got a 7 degrees of range of movement. So these machines are designed in a such a way to have almost 360 degrees range of movements. But the machine doesn't do the surgery. It's the surgeon behind sitting at the surgeon console. He does the surgery, and all these movements are translated through the machine into the patient body. And we have got three components: one, the patient cart, vision cart, and the console. Console is where the surgeon sits and operate. So that is one part. And coming to the surgical part, we usually do the pneumoperitoneum inside and create the environment for the placement of the ports. There are ports called R1 port, R2 port, and camera port, and other ports. So these instruments are like a small 8 millimeter ports, and we insert the instruments, and all this converges to the target area, and then it is connected to the cautery machine. So by good magnification and 3D vision, we can dissect all the organs very well. But here the principles of surgical oncology will remain always the same. We are not diverting. So either you do by open surgery, laparoscopic, or robotic surgery, the principles remains the same. But what happens in open surgery, you cut the skin and go to the target area at the last. But in case of laparoscopy robotic, you make a keyhole surgery, reach the target area, then you cut the small incision and then extract the tumor. So the body immunity is well preserved. There is a huge difference in the outcome of the robotic surgery. Most of the patients, their recovery is very fast. The pain is very less, and they are with small doses of painkillers. Next day they will be sitting, and it will be a great surprise. Sometime I find them whether they have undergone the surgery or not. When we ask the patient, they say that I am perfectly fine, doctor. I had breakfast and all that. They were almost ready to go home in 1 or 2 days. So that indicates that limited stay in the hospital, less of ICU requirement, less of blood and blood product consumption, and they can go back to the work fast. And if he's a working person, then he can join to the work. So here what happens in these instruments, we usually, if it is a rectal cancer, we put all the instruments and then dissect the tumor area, and then take identify the lymph nodes and take out all the tumor one go, like loco-regional lymph nodes and the primary tumor area. Suppose if it is a gastric cancer or even the rectal cancer, we do what we call intracorporeal joining of the intestines, because the human hand is it has got like these movements. When we rotate, the instruments will also rotate in the similar direction. But when we give a person a two pen, one pen in his right hand and left, it ask him to write continuously, at the most he can concentrate with one hand, and the left hand goes into standstill. But in case of robotic, there is a intuitive thing where both the hands can work together, and the mind can understand, and because of the 3D thing, both the hands will be working parallelly. There is no inhibition, and when we put the into the console, we see a huge magnification and all that. So this will add up the better quality of surgery, and following the surgery, we have seen that the good quality of specimen, that is most important for the pathologist to look at, and then they'll be able to identify these planes and also lymph nodes and all the vessels where it has been ligated on, all that. So it's a very good comprehensive oncological surgeries. This can happen with a robotic surgery. Robotic surgery is top in the minimally invasive surgery. But subsequently the laparoscopic surgery was also existing earlier, but now because of the better ergonomics, easier learning practice, and also the fast track surgeries are happening, so the patient's appreciation and then the willingness to undergo these surgeries have become more. So in the Aster International Institute of Oncology, we are aiming to do a very complex surgeries which are more challenging, and patient coming with a second, third opinion where it is not possible, we are aiming to try to do these surgeries in a very big team of doctors here. And basically we are looking for more challenges and doing more sphincter preservation surgeries, and then limited resection of the tumor like organ preservation surgeries for the pancreas, stomach and esophagus, colorectal, and even in the chest, the lungs, and even the mediastinal tumors. So these are all the area of our focus, and probably with the robot we can march fast and try to do the best surgeries and with an excellent outcome.